Hi, I'm Dr. Emily Brandt, one of the developmental pediatricians here at the Anna Shaw Children's Institute, and today we'll be talking about ADHD. So think about the things that might be distracting you right now. Are you hearing noises in the background? Are you thinking about the things that you need to be doing this evening or what you might need to pick up at the store? Are you remembering things that started this morning and didn't get quite finished? Or perhaps are you checking your phone and not paying attention to what I'm saying right now? Lots of things might be distracting you. Now, how would you feel or how would you function if you couldn't filter out those distractions? If you only heard a little bit of every sentence that I was saying, it would be really hard to follow instructions. It would be hard to get through your activities. And for kids, it would be really hard to learn information that they were hearing from their teacher. So officially, what does inattention look like? There are 9 criteria that we look at, and there are some things that you might have heard before, things like careless mistakes, difficulty paying attention, not seeming to listen when someone's talking to you, difficulty finishing tasks, being disorganized, struggling with starting long tasks that seem like they'll be overwhelming, losing things, being easily distracted, being forgetful in your daily activities. Those things can really make a big difference in how you're able to pay attention. Now, on the hyperactivity side, there are also 9 symptoms that we look at. Things like fidgeting, getting out of your seat when you're supposed to stay seated, running or climbing around at the wrong times, trouble paying attention and playing quietly, being driven by a motor, and then things like talking excessively, blurting out answers, and difficulty waiting your turn, as well as interrupting and intruding on conversations where you're not expected to interrupt. So officially, when we're looking at the symptoms, you need either 6 of the 9 on the hyperactivity side, 6 of the 9 on the inattention side, or 6 of 9 of both. You can have symptoms in both categories. And when we're looking at the diagnosis, we also expect at least some of those symptoms to be present before a child is 12, although a lot of people get diagnosed well before then. We also want to make sure that the symptoms are happening in more than one setting. And the reason that that's important is that we have to think about other causes. If a child is only having trouble paying attention or being hyperactive at school, maybe there's actually trouble with their learning. They have a learning disability. If they're only having trouble on a sports team or during their music programs, then maybe they're actually anxious, or maybe they have some motor skill problems that they're worried about. So we want to make sure that they're having symptoms in multiple settings, not just in one place. Of course, if we're going to actually give a diagnosis, it really needs to actually interfere in their life. If you have some trouble paying attention or trouble with hyperactivity and being impulsive, but it's not really making any problems, then we don't want to give a real diagnosis. And of course, we always think about whether it might be due to something else. Is there a problem with sleep? Is a child being bullied and they're stressed about that and that's why they're having trouble paying attention? Or like we mentioned, things like a learning disability. Parents will often ask me, how often does ADHD happen? We hear about it so much. So officially, we have some statistics from 2016 that 9.4% of children in the US were diagnosed with ADHD. Now, it's interesting to notice that only a little over half of those children were actually on medication. A lot of them were being managed other ways. So again, just because you have a diagnosis doesn't necessarily say you'll be treated in a certain way. It's important to recognize that it is more common in boys, and so you may be thinking about that as your doctor is talking to you or your teacher is talking to you. Another interesting statistic helps us understand where it comes from. When they do studies with genetics, if both twins have ADHD, they're probably more likely to be identical twins, meaning they have the same DNA. And so when they both have ADHD, that helps us realize there's something in the DNA that's actually promoting this. Compared to twins who are non-identical, are much less common to both have ADHD. Obviously, there are other causes besides just genetics. There are things that a child can have been exposed to, like lead, things like head trauma, challenges with prematurity, or exposure to substances when a child was in utero still. Those can all have an impact and lead to ADHD as well. So the next big question that families always ask me is, well, how do you treat ADHD? And the reality is the treatment depends on a number of things. One thing is their age. When we're looking at a child who's really young, 4 to 5 years of age, we're really going to try and do behavioral therapy first and only consider medication if behavioral therapy is not enough. As children get older, we'll combine medication and behavioral therapy, or if they're old enough and they've been through the behavior therapy and it hasn't really made a big difference, then we'll really just focus on the medication. The treatment also depends on how severe the symptoms are. Again, we really only want to medicate if it's causing a problem. So, what are some of the problems that you might be seeing? The most common one that families will talk to me about is difficulty with learning. If they're worried about the child falling behind or even just not reaching the potential that they know they can. Another concern is social challenges. Some of our kids are so impulsive and intrusive that other children start to back off and say, oh, I'm not sure, I want to play with you. I'm not sure I want to be around you because you may be getting in trouble in the classroom. And so it can lead to some social challenges. And then we also think about safety, of course. For some of our kids, they're so impulsive that they're running out into the street or running out into like parking lots. And so we worry about the safety component as well. So when we say behavior therapy, what does that look like exactly? And we'll talk about more strategies here in a few minutes, but when we think about behavior training for families, we're talking about what strategies do we use for discipline? Do we use rewards? How do we use timeout or calm down time to help kids get control of themselves? Strategies like giving them short commands that are just one step at a time to help them get through activities rather than being overwhelmed with a lot of commands. Then teachers will put a lot of accommodations in place at school. I'm sure you've thought about, being in the front of the classroom where there are less distractions. They'll often redirect children and help them get back on task when they're distracted. And sometimes they'll do things like exercise breaks when it's so hard to sit still for even more time. For older kids, they may use things like assignment books and teacher check-in to help them with their organization that might be a challenge for them. Since organization can be a challenge for a lot of our kids with ADHD, using things like a visual schedule, making lists and routines can all be helpful. And again, we'll talk about those in a little bit more detail here in a few minutes. Now, families do always have a lot of questions about medication, and so we'll talk fairly briefly about this since that's really a conversation you should have in depth with your pediatrician or whoever is working with you on the medication. So just to give you a framework, there are 3 main types of medications that we use, and they're really classified sort of by how they work. So the first one there is the alpha agonists, and then we think about norepinephrine reuptake inhibitors, and then what are called stimulants, and they're really thought to work on the dopamine levels. So some of these medications are FDA approved for different ages, so that will be taken into account when your doctor is thinking about medication options. Some, but not all of the possible side effects will be described here in a minute, but it's always important to look up additional information, and FDA.gov is a great place to look for medication information. So again, the brief run through the medications, those alpha agonists that we talked about, the most common names that you'll hear are guanfacine, Tenex, Intuniv, or clonidine. Really, they work most effectively to slow down some of the hyperactivity and impulsivity. And we do see side effects, since they're slowing things down a little bit, we see side effects with sleepiness potentially, which we all know can lead to grouchiness sometimes. We watch for things like dizziness or a slower heart rate or constipation. And we talk with families about how important it is to keep the medication going consistently every day, because if you suddenly stop it, we can have a big rebound and not feel too good at that point. Then the second type of medication we think about are those norepinephrine reuptake inhibitors. And the names for those are, that you'll probably hear the most would be Strattera or atomoxetine, and then a really new medication called Qelbree. Now, these especially help with attention span and potentially help with hyperactivity as well. They have a wide range of side effects, stomach aches being one of the most common ones that we hear about, and so we go slowly to try and avoid those. But we watch for any changes in mood and sleepiness because those can be impacted as well as the other things there in the list. And then the most common type of medication that you've probably heard about would be what we call the stimulant medications, methylphenidate or amphetamine dextroamphetamine combinations. There are a lot of different brand names that I'm sure you've heard about. Now, these medications work for both the attention and the hyperactivity challenges. And they do have some pretty strong side effects, potentially with a decreased appetite. Now, it's important to remember that the side effects for these medications only last for the few hours that the medicine is working. And so if a child isn't very hungry for lunch while the medication is in their system, they're often very hungry in the morning and in the evening, and we can make up for the appetite loss at lunch. So we watch those things carefully, as well as the list of other side effects there, to make sure that they're being safe and that we're limiting the side effects as much as possible. So how do we choose what medication to give? Well, it's really determined by what the biggest need of the child is, whether it's hyperactivity or inattention or both. We also think about other health issues like heart problems in making a decision about medication. The child's age definitely comes into play with that, as well as whether they can take pills or whether they need a liquid or a chewable medicine, as well as what time of day needs the support. As I mentioned, we think about the stimulant medications working for a set number of hours. Well, if there are really challenges that are of big impact all day long, we may need to think about a different medication because we may not just be able to focus that on school time in the early afternoon. So those will all be factors that you'll be talking with your doctor about. Are there alternatives to medicine? Well, there always are. The research is pretty limited, which is one of the challenges. There are some studies that suggest a combination of omega-3 and omega-6 can be helpful, as well as zinc is another option. I would watch carefully when you're looking at any supplement and look up the different ingredients that are on there and the potential side effects of those ingredients. It's important to be really aware of that. They may simply have things like caffeine to make them focus, and then the other substances may not be helping as much. So be very aware of what's listed on the ingredients and what those might impact. There are other types of therapy like occupational therapy or things like neurofeedback or brain training apps that you might hear about. Some children seem to respond well to those and others don't have as much success. So these are all things that you may look into or talk about with your doctor. Now, sometimes the most helpful, since you'll be talking again about medications with your doctor, is to talk about some strategies to just deal with life in general. When we're looking at hyperactivity, exercise is a big strategy to help with. Now, can you burn all of their energy? No, probably not. But it's important to let them have an outlet for that energy. Walk and talk if you're trying to have a conversation, or sometimes when you're in a meeting, you're probably fiddling with your watch or fiddling with your pen. So think about having something for them to fidget with or doodle while they're listening, because they may actually be paying attention better if they're actually splitting their attention with doodling and listening at the same time. Having things like background music or timers, wiggle chairs where they can move around, or even standing up to do work can really help with focus. And then take a movement break after they've done some work so that they can, again, get some of that movement out and then come back and focus again. When you're working with your daily routine, a visual schedule can be really helpful. Having a list of the things that your child does, whether it's in the morning before school or at bedtime, what the expectations are, can help them get through without you having to say over and over and over again what you're expecting. And they feel like they're able to be a little bit more independent and not forget as easily. Having a consistent routine can also be really helpful because they may learn that routine more easily if it's consistent. And then having consistent places to keep important things, just like a lot of people will keep their keys in a certain place or their purse in a certain place. Having certain places that you try to train and remember to put over and over again, those certain things, just can help a little bit avoid losing things, which is so easy to do. Homework is another big frustration time for a lot of our kids, and so thinking about strategies to get through that is important. You may have the child stand up at the kitchen counter to do their work, or sit on an exercise ball so they could be moving around a little bit and yet staying in the same place. Like we talked about, working for short bursts, maybe set a timer for a couple of minutes, and then, okay, let's get as much work as we can, race the timer, and then we're going to set the timer and have 2 minutes where, we run some circles around the living room, or, you do some exercises in some way. Breaking work down into small chunks can also be helpful. If you've got a long page full of problems, covering up most of the page so they only see a few at a time can help keep from feeling overwhelmed. And then remember the timing. If your child is on medication from the morning and it's going to wear off at a certain time in the afternoon, try to get the homework done as quickly as possible before the medication is worn off so they're less frustrated. Early morning can be another time, not that anyone really has a lot of time to be doing homework before school, but should your schedule allow, sometimes it's easier to get the homework done then. And consider doing it, especially if the medicine's all worn off, after some really strenuous exercise. Go jump on the trampoline for a few minutes or run some laps around the room and then try and sit down and focus. That may make it a little easier. Following instructions are hard, obviously, for a lot of our kids with ADHD and a source of pretty substantial frustration for a lot of families. So like we talked about, those visual schedules can be helpful, especially using pictures for some of our younger kids who can't read yet, or making lists of what the expectations are after school for older kids. If you're giving instructions verbally, I'd really recommend trying to give just one instruction at a time and have your child repeat that back to you. Then go off, do that one, and then they come back and get the next instruction. Because hopefully that will be easier for them to keep in mind. And then, like we talked about with the homework, set a limit, set a timer and say, okay, you've got 3 minutes to get this done, and then the timer will go off and that will remind them to come back and report, hopefully, that they've completed the task. Are there things that can make ADHD worse? Absolutely. So, sleep, obviously, we all know that if you're not getting a lot of sleep, it's really hard to pay attention and keep from perhaps doing impulsive things the next day that you might not naturally do. So for our kids with ADHD, settling down to sleep can be a hard time. Some of our kids will actually wake up overnight. They may be hungry because they didn't have quite enough food to make up for their lack of lunchtime appetite. Or things like snoring can disrupt the quality of their sleep. So it's important to look at those things and make sure we've got good quality sleep to help them function during the day. Now, there are lots of different ways to work on sleep. And I'm sure you've heard lots of strategies like getting the screens off at least 30 minutes before bedtime, having the room quiet and dark, the child slowly adjust to falling asleep by themselves so that then they have the confidence if they sort of wake up a little bit overnight to get back to sleep on their own. And then again, for some of our kids, if they're really hungry from the daytime, having a bedtime meal can really help them sleep more soundly rather than waking up hungry. Even though that's not healthy for most of us to have those late bedtime snacks, it can be really important if we're not getting enough food during the day for the kids. And then of course, check with your doctor if there are concerns about tonsils, and if you feel like you need to try some melatonin. Now, it's also important to take a minute to think about how many hours of sleep we're aiming for. And these often really surprise people. When we're looking at the goal number of hours of sleep that the American Academy of Pediatrics recommends, it's really quite a lot. So up to 12 months, we're looking at 12 to 16 hours a day, including naps, perhaps not quite so difficult. As we get older, you can see there's surprisingly quite a long sleep time that's still expected even in the 6 to 12 year range, not to mention the teenage years. Most kids are probably needing a good bit more sleep than they're getting, and that might help them focus a little bit better. Is it going to take away their ADHD entirely? Probably not, but anything that makes the daytime and focus and self-control a little bit easier is worth trying. There are definitely other complicating problems that can look like ADHD. Like we talked about, having a learning disability or an intellectual disability can make it really hard to pay attention in a classroom setting. Things like bullying or stressors in life that have happened, anxiety and depression can make it really hard to pay attention and perform the way you expect. As well as other syndromes like autism spectrum disorder, oppositional defiant disorder. And then for older kids, we think about substance use if we're suddenly having a new problem with self-control or attention problems. Or you can have both. Now, families will often ask me about what to expect in the future when we have an ADHD diagnosis. And while studies vary, what is often talked about is that probably about a third of ADHD symptoms, or a third of people, will have their ADHD symptoms completely resolve into adulthood. About a third will still have some symptoms, but they may or may not need medicine. They may be able to just manage it with the strategies that they've learned in life. And then about a third probably still have enough challenges with their symptoms that they really need to take medicine in adulthood. Families will often ask about planning for teenagers as well. And it's an interesting point. When they've looked at studies of large groups, they actually find that risk-taking behavior, when we think about drug and alcohol use and other risky behavior in teenagers, is actually often decreased when kids have medication that has their ADHD under good control. They're feeling more successful in school, they're being less impulsive with their decisions, and they actually generally have safer behavior. Now, driving safety is also another important thing to be thinking about. And as your child starts driving as a teenager, if they are on medications, it's important to remember the time of day and whether their medications have worn off when we're thinking about what time to do driving practice. Again, if their medicine wears off at 3 or 4 in the afternoon, but our driving practice is not till 6, then we potentially have a safety concern there where they may be a lot more distracted. Now, it's also an interesting thing to note that a lot of our teenagers, as they are taking the medicine, they're starting to realize that the medicine is calming them down a little bit more. They're not as impulsive, and some of them feel like they're less energetic and life of the party as they are without their medication. And so interestingly, a lot of our kids, as they get older, will really want to start getting off of their medication. They're very motivated to start decreasing the doses. And so that's a great opportunity for us to say, okay, you want to start decreasing the dose? Well, let's slowly decrease, and then you can practice these strategies and see if you can handle it on your own. And so they'll often work with us to really be motivated to start decreasing their medicine. And the other interesting part of that is that medications are not typically misused by the child that they were prescribed for. A lot of families are worried about these medications being misused. And like we said, a lot of our kids will recognize that the medication, while it helps them in some ways, has other side effects that they don't like as much. And so most of them are really trying to get off of the medicine instead of misusing it. So while nothing is 100%, hopefully that helps you feel a little bit more reassured as we're looking at the teenage years with potential medication. Now, it's always important to leave you with some resources, and these are some great websites that can be helpful for you as you're looking more at ADHD and supports for your children. I hope you've enjoyed this presentation and that if you have additional questions, you can look at one of these sites or talk with your pediatrician about your concerns.